Rocio Contreras has worked at South Texas Health System for longer than the Children's Hospital has been around. A registered nurse since August 1999, Rocio, now the clinical supervisor at STHS Children's, vividly remembers the need for a dedicated children's hospital in the Valley, while caring for pediatric patients in the same space as the adults on the second floor of STHS Edinburgh.
Back in the day, if we had an emergency situation or things like that, we had to stabilize the patient, stay with the patient until somebody from McAllen Medical would come and pick up the patient, because McAllen Medical was the only facility that had a PDICU. So it was very stressful, not only for the staff, but for the patients, because we were not equipped to handle emergencies like that.
Beyond the lack of emergency care, Sonia Palmer recalls the need for specialty pediatric care. Sonia, who originally worked in the pediatric ICU at STHS McAllen before transferring to the Children's Hospital when it opened, remembers the many families who had to leave the Valley to get special medical care for their children.
Corpus was like the closest thing, but if you really had to go to like a specialty, it was either Houston or San Antonio, depending. Because we live so close to the border, a lot of times there is a lot of people that couldn't travel over there, so they had to do with what we had here.
But that all changed when, after a couple of years of planning and construction, STHS Children's officially opened its doors on March 4, 2006, as the Valley's first freestanding pediatric hospital.
We're going to have our pediatric ICU and our hospital. It was just really exciting to know that the community needed a hospital like this, and South Texas Health System was able to provide what the community needed.
Norma Salinas, one of the charge nurses at STHS Children's and the hospital CPR instructor, is especially proud of having the Valley's only dedicated pediatric emergency room and pediatric emergency waiting room.
When you have an emergency room that is not dedicated to children, you have adults and children mixed together, and that can be really scary for kids, because sometimes they could be seeing things that, is not appropriate for a child to witness. And having a ER that's dedicated specifically just for children, and staff that's trained to deal, just with children, I feel like it's a much better experience for the parents and for the child.
From having a dedicated children's emergency room and a freestanding hospital that provides access to specialized pediatric care, to creating a colorful, kid-friendly facility and offering compassionate care and support, the staff at STHS Children's is most proud of serving those littlest members of the community and their families.
I think we've come a long way, and I think we're making great strides in keeping up with everything that we need.
And the members of the STHS Children's family, including the originals who've been here since day one, look forward to seeing what the next 15 years bring.